Hi, I'm Dr. Donald DeFabio, and it's a great day to talk sudden, acute, low back pain. You know, when you're bending and you get stuck and you can't get up. And what I'm going to show you works because I just did it for the past week, because that's what happened to me. I was bending and twisting and it gave me that zinger. So the first thing I did is I went and got out my ice pack, 20 minutes, 3 to 5 times a day. Next, I had my lumbar support belt on. I keep a lumbar support belt around the house because it happens. I like this belt because it comes up into my mid-back area and it really helps stabilize me, and these tension tabs can be adjusted. So I had the belt and the ice on at the same time while I had my home muscle stim unit on. So I had muscle stim on, ice, and the belt for 2 days. Walking was good, so I did lots of walking. I stayed away from sitting. Sitting was no fun, especially the getting up. Luckily, I wasn't having any leg pain, so it all stayed in my back. On top of that, there were 2 other things that I did. I was using Phyto-Zol, which is a topical cream for pain. The great thing about inflammation and pain reduction with Phyto-Zol is it has a transdermal agent in it, which means the active ingredient gets absorbed through the skin into the muscles. Works great. First day I used it 3 times in an hour, then I used it 2 more times, and the next couple of days was 3 times a day. And lastly, I was taking ZYMAIN, which is an anti-inflammatory nutritional supplement, extracts of pineapple, papaya, worked really well. 3 of those twice a day. So 2 days were really rocky. Then it started to loosen up through 3rd or 4th day. I'm a week in. Mornings are still tough. I have been doing some stretches, so let me share those with you. The stretches that work well are my hip flexor stretches. So getting down into a hip flexor position and opening up the hip flexor in through here has been working well. I've also been doing some gentle press-ups in through here. In the beginning, I couldn't come up this far. I was just pressing up like that, and then like that. I was doing press-ups. Oh gosh, the press-ups and the hip flexor stretches, all my stretches were 20 to 30 seconds, sets of 3. As the press-ups got easy, I built up to sets of 10. I did some single knee to chest, which was very innocuous. It's always a good one. And of course, the piriformis, the hip stretch, is really money. That really gets this one going really well. So the figure 4 stretch is one of my favorites as well. And that's the last one. And luckily today I can start to add rotation. So I did some of the star stretches. This leg goes over the top, arms are open, look to the opposite side, and just breathe from the belly and just let that all open. And of course you do stretches on all the sides, all right? So I was able to get through my current episode of lower back pain with some simple things right at home because I wasn't able to get to the office to get a treatment. You can do the same thing, but as soon as you can get to the office, get in, because research has shown the frontline treatment for acute and chronic low back pain is chiropractic spinal manipulation, acupuncture, tai chi, yoga, massage. In the medical journal, JAMA, British Medical Journal, Lancet, CDC, FDA, they all recommend that as a frontline treatment. Drugs are a 2nd and 3rd line treatment. So I'm Dr. Donald DeFabio. Have a great day. Thanks for tuning in. And if you have any questions, just give me a shout out. Or if you need more information about the tools I use to get better, they're all detailed in the description of this video. Have a great day and stay healthy.